Well, hello, Jillian. This is the inside of your knee. What we're seeing here first is your patella, the kneecap, which is on top of the screen. So you can see the fibrillation of the cartilage. It should look perfectly smooth like some of these other areas, but here you can see this thin, irregular area. We're actually starting to see a little of that coloration is the bone underneath. So this is what's partly creating your symptoms, creates the grinding, and we'll address this with a procedure to smooth this. Below, though, your femur here, not so bad. We got some fissuring and roughening here. You can see the cracking that's starting to happen. So now as I bend the knee, you can see how these two rough surfaces articulate or track on each other. This is what can cause the pain, and it can create that crepitance that we call. So again, I'll smooth this as well to stimulate a healing or repair process. You can see the kneecap tracks very nicely, though, so there's no malalignment. In the background here, you can see your synovium. See how it's thickened and reddened, this villus type formation. It just tells us your knee has been inflamed, as you know. Well, this is your medial compartment. So again, we have nice smooth cartilage here, but you can see we do have the starts of some breakdown of the surface here. This is towards the central portion, so not really the major weight-bearing area. So again, I will address this and clean this up. You can see the meniscus. Mostly this meniscus is intact. We have a small little start of a tear here, which I can address in a real simple way. But we're going to preserve pretty much your whole meniscus here, but we want to stop this from starting to break down. So the shaver here is going to remove these loose fragments. These are what floats in the knee. You can see this fluffy synovitis here. It's also in the middle of your joint, which impinges. We're going to clean this out as well. This is part of what happens with the symptoms as you continue to get the synovitis and the inflammation, the swelling. This tissue gets in the way. And we're seeing the ACL is right there, which is perfect. And this synovitis is sitting right on your meniscus. Now you can see, we can see the whole meniscus now. It's not in the way. Your knee is flexed right now. So that's eliminates it a little bit. But you can see as we extend the knee now, that tissue won't impinge right in the front of your knee. So you can see there's your anterior cruciate ligament, which looks great. So here's this area. It's just stabilize that area. You can see the color changes. We use a device that generates low energy. See how smooth this surface here, so we don't have that loose flakes or fragments. And this will stimulate a repair process. But pretty much this whole meniscus is still all intact here. So this will be good. But you can see the change from here to here that we'll just have to keep a watch of. So this area was filled with synovitis, cleaned it out, but now you can see right underneath it we have a cyst. So this is what's called a perimeniscal cyst. And again, I'm going to very simply just trim this away. This is right in the front and towards the outer or lateral compartment. Again, your knee is slightly flexed. So you can see as we straighten your leg, you're going to see how the cyst impinges there in full extension, and then as we flex the knee, you can see it opens it up. But you can see with every step, when you straighten the knee, and you can see how this can interfere. So we're going to clean this out of there. There's your ACL right here, which is normal. So you can see here, we're going to get this right off of the front of the joint. And it's right next to your lateral meniscus, which is right here. So there's your lateral meniscus, which looks great. Really, this part of the joint looks real healthy. Little bit of minor change there, but very insignificant. Keep in mind, everything's magnified. The tip of that probe that you're seeing is 4 millimeters. Yeah, so this was where that cyst was. It's now gone. I'm going to further contour this with the device that generates this low energy, so we can keep this meniscus healthy. So here's another look at the anterior cruciate ligament, perfect. Posterior cruciate ligament over here, perfect. The cyst was sitting right here. You can see the little coloration there again from the cautery device, the coblation it's called. This is the anterior horn of your lateral meniscus. So it's sitting right here, impinging, which is now is gone. And you can see your compartment here looks great. So this part is really good. So really overall not bad. Most of it's in that kneecap area. So this is that synovitis that was present. It was impinging in the patellofemoral area. You might have saw it earlier. Again, I'm just going to clean this away. This is nothing structural, so getting this off of the joint is going to help with the symptoms of pain that you've been having. This is what continues to build as we get that chronic synovitis going. So you can see now as we look at your kneecap, we're now starting to see the whole joint without this tissue in the way. So again, this is very simple to do, and then I'm going to smooth this surface as well, and then we'll contour that surface with the coblation, which is basically like a radio frequency, low energy. And essentially, it shrinks the tissue. It'll stimulate this repair process so that we can get some fibrocartilage healing, so we can stabilize the joint and stabilize your symptoms and improve them. Well, here's one more look at your knee, and you can see there's still this thin area of cartilage. I've smoothed the fibrillation to help control those pieces from floating in the knee. Again, the trochlea here is not too bad. We do have some thinning and irregularity here that we're going to have to watch and keep an eye on, but this is the main area of the arthritis, is this kneecap. Over here we had that inflamed tissue that's now gone. You can see all the way down to your joint space here. There's your ACL. The cyst was here, which is gone. Your lateral side looks real good with no significant change. A little minor change here. And your medial side was the one that is the other area that we're starting to see this thinning. But the meniscus is intact. So we'll get you started, see if we can get this knee back on track.